don't just go away. They get worse. A manageable infection becomes sepsis. Uncontrolled diabetes becomes kidney failure. A missed appointment today becomes an ambulance ride tomorrow. And that's not just tragic, it's expensive. When we don't treat illness early, we pay more in every way, in dollars, in suffering, and in lives. And what about preventative care? That's where Medicaid shines. Mammograms, vaccines, annual checkups, those aren't extras. Those are the basic tools that catch disease before it spreads. And that prevents strokes and heart attacks. That saves lives quietly, efficiently, every single day. Without Medicaid, people skip the care they can't afford. And yes, people suffer and people die. This isn't a red state or a blue state issue. Illness does not ask who you voted for. In every corner of the country, urban, rural, coastal, heartland, real people are struggling to make ends meet. They're working 2 jobs, raising kids, caring for aging parents, and when illness strikes, it can all come crashing down. Medicaid steps in and says, "You're not alone, we've got your back." And let's not forget that Medicaid pays for the prescriptions that people need to work and to function and to live. Antidepressants, insulin, blood pressure medications, these aren't optional. They're the difference between stability and crisis, between productivity and disability, between life and death. As a psychiatrist, I want to be clear about one more thing. Mental health is Medicaid. The vast majority of community mental health services in this country are funded by Medicaid. When someone is experiencing psychosis, addiction, suicidal thoughts, or severe depression, it's often Medicaid that ensures they can see a therapist, that they can get medications, enter treatment, and begin the path to recovery. Without Medicaid, our mental health infrastructure collapses. And with it, the safety net that keeps individuals, families, and whole communities safe. So I ask you today, remember, Medicaid is not just a program, it's a promise that we make to each other, a promise that we care for each other, that we believe in early treatment over emergency intervention, that we understand real people face real struggles and deserve real support. For our neighbors, for our families, and for ourselves, we must protect and strengthen Medicaid.
And next we will hear from Florencia Chang from our Community Advisory Board.
Good afternoon, everyone. Thank you, Congressman Jeffries. Thank you for attending today. It is vital that they not cut Medicaid. It's a necessity. It is said that an ounce of prevention is better than a pound of cure. And we need this hospital to stay vital to this community. They're great doctors. They're great programs. They have upgraded many departments, and this community needs them. Thank you.
Thank you very much. And next we will have one of our registered nurses, Ms. Sibylla Douglas, who is also an 1199 delegate, who will give us a perspective from nursing.
Good afternoon, everyone. I'm Sibylla Daniel Douglas. I'm a registered nurse here at Brookdale, and I've been an employee at Brookdale for 35 years. And as Dr. Scott said, I'm also an RN delegate. The fight to save Medicaid is crucial because we provide care to an underserved and at-risk community. Our patients are already at a disadvantage, and Medicaid cuts will be extremely detrimental. These huge Medicaid cuts will impact our healthcare system and our community in more ways than you can ever imagine. I work in an outpatient setting, and our primary focus is on preventative care, keeping our patients well and out of the hospital. We see many children who have Child Health Plus and Medicaid. When these programs are slashed and the cost of health care becomes too expensive, working people are going to have to choose between buying food, paying rent, or making sure that their children go to the doctor for well visits and life-saving vaccines. Now, what do you think will be their priority? Immediate need for a roof over their head and food to survive. Healthcare will suffer. Throughout my career as a nurse, I have witnessed firsthand what happens when people don't receive preventative health care. As an emergency room nurse, I saw people end up having strokes, developing end-stage renal disease, and going on dialysis. Some became permanently blind, and all because of poorly managed chronic health conditions. In the long run, taking people off of Medicaid only makes healthcare more expensive for everyone, because minor health issues develop and then turn into emergency situations that take up a lot of resources. And those resources are both human and financial. I would like to end by saying, when healthcare coverage is systematically taken away from vulnerable families, the consequences are devastating. I personally believe that this is a systematic way to reduce the population. Slashing Medicaid and defunding institutions like Brookdale would be waging war on our communities. We cannot allow this to happen.
Thank you very much. And now we will hear from Ms. Elaine Raffington, representing the Guild of 1199.
Good afternoon, everyone. Thanks for having me. Thanks for coming, Hakeem Jeffries. I am a proud employee of One Brooklyn Health System, Brookdale campus. Let me tell you about the Medicaid cut. I listen to the cries of the community. I'm a MOA, I'm also a health coach. We need Medicaid funding for this community. Mental health issue is a vast population of this neighborhood. Diabetes, hypertension. I often listen to the members, listen to the community. It's devastating. This hospital is a trauma hospital. We serve the community in the pandemic, and we are near to the airport. Should there be a disaster, what would we do? Look at COVID. We were the #1 institution in this black and brown neighborhood to accommodate. I don't even want to remember it. Anyway, moving forward, I'm asking Hakeem Jeffries to be the voice of reason for our community, not for our 1199 members alone, for our friends and family of this community, for management, for everyone. Medicaid shouldn't be a cut. We need more Medicaid. And when we fight, we win, and we are going to stand up for more Medicaid funding to keep this hospital open. We are tired of developers coming in the neighborhood and taking over our community and make it real estate. We need more hospital. We need more Medicaid funding. Thank you.
So thank you very much. Thank you to our leader. Thank you, and no Medicaid cuts. Thank you. Thank you.